Smoking and vaping are on the rise, and my students ask me, how do we treat a patient who has been smoking for a long time, a patient who developed COPD? Make sure you watch till the end, because at the end, I will describe the medications that we administer to patients to help them have a quality of life while living with COPD. Long-term smoking leads to COPD, which is chronic obstructive pulmonary disease. This is an irreversible disease that presents as airflow limitation, leading to chronic bronchitis and emphysema. Chronic bronchitis is inflammation of our airways, and emphysema is alveolar destruction. The lung sacs are destroyed. Smoking releases inflammatory cells in our body. Now, these neutrophils and macrophages release enzymes that destroy the lung sacs in our lungs. The lung sacs become stiff and they're hard to recoil. This leads to impaired gas exchange in the body. When someone has been smoking for a long time and develops COPD, first it starts with a chronic cough, difficulty breathing, a low oxygen saturation in the body, fatigue because their muscles are not getting proper oxygenation. This leads to wheezing, cyanosis, bluish tinge on their lips, leads to barrel chest as COPD advances. Then the patient has to do pursed lip breathing in order to get their oxygen requirements. COPD patients also experience orthopnea, which is difficulty breathing when they're laying down. Now look at the effects of COPD on organs. When there is impaired gas exchange, the body is not getting adequate oxygen and there is retention of carbon dioxide in the body. This is due to alveoli destruction. The impaired gas exchange compromises the health of our lungs. Our heart develops right-sided heart failure. In COPD, the brain does not get enough oxygen, and this leads to hypoxia. The muscles are fatigued due to poor oxygenation, and immune system is compromised, is suppressed, and it is prone to infections such as pneumonia. Pneumonias are very common in people who have been smoking for a long time. Then the medications, how do we treat COPD? We do provide low-grade oxygen to people who have low saturation because of COPD, but we also give them bronchodilators to dilate and open up their airways. Give them corticosteroids to bring down that inflammatory response that has happened because of smoking. We give them anticholinergics to combat the increased mucus production, and we give them antibiotics if an infection develops. Now, if you want more information on how to combat COPD and how to treat patients of COPD, comment the word COPD and my team will send you a detailed PDF on this topic.